Hello everyone, this is Abike from Addis Ababa University School of Public Health. I'm delighted to share our finding from a research entitled with Availability and Utilization of Psychosocial Services for Breast Cancer Patients in Addis Ababa, Ethiopia. These are the authors and their affiliation. So breast cancer is a leading cancer in Ethiopia, which accounts for 22.6% of cancer cases diagnosed in 2018. So according to several studies, breast cancer patients face emotional, social, psychological difficulties, which are significantly associated with functional impairment, pain, fatigue, and reduced survival. And it's proven that psychosocial services have substantial impact in cancer care by reducing emotional distress, improving adherence to treatment, and enhancing quality of life and survival of patients. However, the implementation of psychosocial services is not well studied in low and middle income countries, particularly in our country, Ethiopia. That's why we try to explore about the types of psychosocial services available for breast cancer patients in the capital city, Addis. So we used a mixed method study design, and we started with a quantitative study followed with small-scale qualitative study. And the study was conducted in 7 health facilities. And we included 428 breast cancer cases, and we conducted in-depth interviews with breast cancer patients and also 5 health professionals who are working in the oncology department. We used a structured questionnaire and interview guide, and we ran descriptive analysis and logistic regression, and thematic analysis technique was used for the qualitative study. So coming to our findings, out of the total 428 breast cancer patients, only 10.9% of the patients ever received psychosocial services, and out of this, 19% of them received counseling service, 23% of them received emotional support, and 57% of received information about their diagnosis. Residence, severity of pain, and duration of diagnosis are associated factors with provision of psychosocial services. And the qualitative data revealed that patients are not properly disclosed. For instance, a 35-year breast cancer patient stated that the way he disclosed me was really shocking. Then I totally isolated myself from any kind of medical treatment and took traditional medicine. And it's also found that there's no structured counseling service. And one of the oncologists that we interviewed, he stated that there's no unit which provides counseling service in a structured way. Most of the time, the oncologists teach the patient about the choice of treatment. So in terms of provision of information and brochures, it's also observed that there is some gap in this regard as well. For instance, one of the patients reported that I was not even informed about the number of cycles prescribed for me. On the 3rd cycle, I asked the nurse and told me as 6. So most of the time, this patient discussed among themselves and got a lot of information about the medication and the side effects. And another oncologist we interviewed reported that we try our best to help the patient with what we can, but we don't provide educational materials or other supports. So when we look at barriers for not providing psychosocial services, the primary reason is high patient flow, and we have very limited number of cancer centers in the country. So the health professionals are overwhelmed and they cannot spend a lot of time on each patient. And some of the nurses also mentioned that there's lack of skill to provide professional kind of psychosocial services. And there is no assigned professional, like there's no clinical psychiatrist or psychologists and social workers who can provide these services. And there is no adequate space, especially to conduct one-to-one kind of counseling service in those health facilities. So as a conclusion, only few breast cancer patients received psychosocial services from health professionals, and the services were not delivered in a structured way. So patients predominantly received social or emotional support from family members, friends, and colleagues. Therefore, psychosocial services should be well integrated in the routine cancer care, both in private and government health facilities of Ethiopia. So we would like to acknowledge Women Health Research Working Group, Department of Psychiatry, all health facilities, study participants, and data collectors. Thank you very much for your attention.